on the whole, there are techniques which have evolved over the years for breast augmentation. And initially, when breast augmentation started, people used to just put the implant behind the breast. But again, there were some inherent complications and problems with it, and the most common was that the implant would start becoming palpable on the upper part of the breast as the breast drops and the breast loses tissue on the upper pole. So as a result, there are new techniques which are called dual plane, and dual plane basically means that breast is lifted up on the chest wall, and then muscle under the breast, which is called pectoralis major, is also lifted up. And the implant actually goes under the muscle rather than under the breast. And in dual plane, there are three types: dual plane 1, 2, and 3. And these all have their own indication as to what would be suitable for that specific or particular patient. Again, as the implants have been evolving, the techniques have been evolving. When this all started, most of the implants were being put under the breast, but there were inherent problems with that. And as a result of that, cosmetic breast surgeons have been working on improving the techniques. And now the technique to use is called dual plane technique, in which the breast itself is lifted up from the chest wall, and then muscle which is behind the breast is also lifted. It's called pectoralis major. And the implant actually goes behind the muscle now, instead of going behind the breast. And when we lift the muscle from the rib cage or the chest wall, again, that is classified into different dual planes: dual plane 1, dual plane 2, dual plane 3. And so I was mentioning about the techniques, the evolving techniques, and the techniques we are currently using. And the background of that is that the implants were put many, many years ago just behind the breast, and there were some inherent problems. For example, palpability of the implant on the upper part of the breast. As the breast drops, the implants used to start being more visible and palpable. And then breast cosmetic surgeons invented a new technique which is called dual plane technique. And in this technique, the breast is lifted a little bit, but the muscle behind the breast, which is called pectoralis major, is also lifted, and actually the implant goes behind the muscle. And this is called dual plane technique, and there are various type 1, 2, and 3. And it would really depend on what we want to achieve in a patient, what the patient wants, and that these techniques are applied to the particular patient. So every patient is assessed differently. Then the other thing which has been experimented and evolved, is the type of approach we have to put the implant. And people have experimented with different approaches. For example, one approach is going through the armpit or axillary approach. And these approaches are strictly for people who want to have saline implants. And this technique is more popular in America, but it's not that commonly used because it's got its limitation.